Hola, mi nombre es Dasy Resendiz. I graduated this past December from the MA and PhD dual degree program from the University of Arizona. The title of my research is Clinica Integral Almas, Tackling the Social Determinants of Health while Cultivating a Community of Care in Rural Guarajillo Macurawe communities of Sonora, Mexico. This research derived from a public health perspective using qualitative research methods. I would like to acknowledge that the University of Arizona sits on the land of territories of indigenous peoples. Arizona is home to 22 federally recognized tribes. Tucson is home to the Tohonotham and the Yaqui. The question that drove this research was the ways in which Clinica Integral Almas has addressed the social determinants of health in rural communities of Sonora, Mexico. How are they being addressed? How are the social determinants of health being addressed in this community? I conducted my field work in Álamos, Sonora, Mexico, recognizing that there are 8 indigenous groups in Sonora. Of course, one of them is being the Guarajillo Macurawe group. Clinica Integral Almas is situated in Álamos. The Clinica was founded by Elizabeth Pettit in 2013. It is a nonprofit. The Clinica is composed of 3 licensed physicians and 2 medical interns in their licensing process through their social services with Clinica Integral Almas. This Clinica provides services to Guarajillo Macurawe communities of 13 villages and surrounding municipalities of Álamos. So it provides services all the way in Chihuahua to the Raramuri. It also works with community health workers from Guarajillo Macurawe communities. So they collaborate, they partner. Both physicians and community health workers are an integral part of Clinica and how they provide services. So some of the services that they provide are diabetes related services. So, glucose checkups, blood pressure. They provide HIV services. They link or connect patients to the Mexican healthcare system. They travel to communities that are 14 hours away. The communities that I was able to travel to were 3 hours away. And when we would go to these communities, it was usually on Tuesdays and Thursdays. So they don't go Monday, Tuesday, Wednesday, Friday. They only go Tuesdays and Thursdays. And sometimes they don't go because it rains and it's really difficult to get to these communities. The terrain is difficult. And so those are the things that Clinica Integral Almas does. This is just a description of, a map description of the communities that I was able to travel. These are Guajaray, Los Estrados, Mesa Colorada, and then Mochibampo, and of course, Burapaco. So like I said, this research was focused on the social determinants of health, or derived from a public health perspective. So the social determinants of health are the conditions in the environment where people are born, where they live, where they work, where they pray, where they play, that have an impact on their health, right? On the health outcome. This could be if they have schools, if they have hospitals, if they have access to hospitals, right? If they have jobs. So these are very important and something that I wanted to focus on. These are 2 physicians that are cleaning up debris from, a previous rain. So they had to get out of the truck to remove the debris. Right? What are the social determinants of health in Guarajillo Macurawe communities, right? They are geographically isolated, right? They lack hospitals. They don't have nurses or physicians. They only have rural health posts that, sometimes are not adequately equipped with medicine. They have faced barriers in accessing medical treatment from the Mexican healthcare system, right? And the Mexican healthcare system is responsible for providing, for example, tuberculosis treatment. And sometimes they don't do that. These communities lack, transportation, right? They don't have cars, so they have to pay, right, pesos, um, to get, transportation. They sometimes don't have cell phone service, right, to communicate if a patient is having a stroke or if a patient is having a heart attack, right? They don't have jobs, right? Some of the community health workers have to travel outside for work, and they lack potable water and nutritious food, right? They depend on the Mayo River, right? They don't have stores that have nutritional food. So these are very important, and Clinica Integral Almas is well aware of these social determinants of health in the Guarijillo Macurawa communities, right? The research or the literature review that kind of guided, what I was seeing in the field and what I was, listening while, I was interviewing participants was that this idea that, medical care alone does not address, people's health, right? Um, and also the role of healthcare providers, how are physicians and patients interacting, right? I looked at Cooper, Livingston, and Brotherton's research, in Venezuelan patients, in Botswana patients, in, Cuba's, in the role of physicians in Cuba. And I think that guided, and that kind of helped me to look at what I was seeing in the field, to make sense, right? And also the role of community health workers in Peru and Mexico and the US, and the importance of, in providing services to their own communities. Like I said, I did 18 interviews, and I, did field observation. I interviewed Clinica Integral Almas physicians. I interviewed Guarijillo Macurawe and Álamos patients, Clinica Integral Almas staff, Guarijillo Macurawe community health workers, and University of Arizona and Mexican healthcare workers. Clinica Integral Almas also has partnerships and collaborations with universities and here in the US and other organizations. Right? So how are, the social determinants of health being addressed? How are they being tackled? Are they being tackled? And throughout the interviews and field observations, I got a sense of these three important concepts: the idea of community of care, accompaniment, traditional medicine, that are very important in addressing the social determinants of health. And in the 3 slides that are coming up, I will show you quotes from physicians, community health workers, and patients that provide us a better look of what accompaniment, of what community of care, and what traditional medicine is, right? I use Paul Farmer's idea of accompaniment. I use Patricia Gonzalez and Trevino's definition of traditional medicine, right? So accompaniment, this idea that two of the physicians talked about that they're no longer talking about medicine, but they're asking patients about their families, right? They accompany the patient more in depth, right? They go to the hospital and, they visit the patient and they ask them, how are they doing? During my time there, I was able to witness how we transported a pregnant mom from one of the communities, and then we went to accompany her to get her blood test done. And then we took her back to the community. So that kind of accompaniment that you wouldn't necessarily see in a Mexican hospital, that is very important to look at here. And then this idea of community of care, right? That the Clinica Integral Almas, along with community health workers, are creating in these communities, right? They're receiving and they are providing this. For example, here community health work talked about uh, the community is very happy with the participation from the physicians in the clinic, how they welcome it, right? How they see it well and accepted, right, in the communities. And then even further by another patient, right, that they're grateful. They thank the physicians and the Clinica Integral Almas um, because they have taught them habits of health, protection, and well-being. And this is significant. This past May, or in 2022, the Mexican president um, paid a visit to the Guarijillo Macurawa communities, and one of the patients, right, that I talked to, that I interviewed, was there, right, demanding the right to access appropriate, adequate healthcare services. They demanded. So I think it has a lot to say, that they were there as a community demanding these services that they deserve, that, it's their right as Mexican citizens. And then also the importance of traditional medicine in these communities, particularly in the Guarijillo Macurawa communities, right? The community health workers are knowledgeable of traditional medicine, right? That they're using both the clinic, Western medicine, and their knowledge of medicinal plants. Because it's been passed down from from their moms, from their dads who are bone setters and healers, right? And this idea of passing it, so that their children can learn, for the good of their families and their communities. So these three things I thought were very important, and they came up as I was doing, I was doing the analysis of the interviews. Overall, right, Clínica Integral Almas in the Guarijillo Macurawe communities and the healthcare workers have been able to address the social determinants of health. They have been doing this through accompaniment, through community of care, traditional medicine, and the importance of collaborating, right? I saw how community health workers and physicians were collaborating, and the importance that has on tackling the social determinants of health, and what we can learn from this, and what other organizations can learn from the way that they work. Right. And then I think I encourage others to collaborate with Clinica Integral Almas. Community health workers want more training, right? I think, partnering with the University of Arizona and other organizations is very crucial to, how they continue to provide services. I'd like to acknowledge, right, the following. Thank you, Tinker Fellowship Foundation, for allowing me to go to Álamos, the Center for Latin American Studies, Clinica Integral Almas, Dr. Stephanie Grader, Elizabeth Pettit, Araceli Rivera Cohen, and Felina Cordova Marx. Thank you for your support. Thank you again, and have a good day.